When I began my conversation with Dr. Omo Emeagui of Nigeria, I had no idea where the discussion would lead us. And by the time we finished the first part, she was answering my question about what the plight of a child will be whose parents did not have the financial means or the education to be able to get or find the resources that their child would need who had any developmental delays. As part of that question, I also wanted to know what the plight of that child will be if the child and the child's family lives in a rural part of the country. Please continue to watch, and you will hear some remarkable information about the Nigerian healthcare system and what doctors like her are trying to do.
So there are a lot of health challenges in Nigeria. First of all, the PHCs are non-functional. We need to revamp them. We need to encourage training of healthcare and training of healthcare workers in certain specialties that are not available. And a lot of fund has to be channeled to that. It's just like what is going on presently in the nation, the COVID-19 outbreak, pandemic. You can see that the healthcare sector was not ready. In fact, we are not ready. Apart from Lagos, who preempted that there might be the first contact may be coming through Lagos because that's the most busy airport into the country or out. Other states were just sitting down and looking. Now we waited for NCDC to announce 1 or 2 cases first before we started making very rapid, quick efforts to put things together. And if you go now at this point and say, you see why the average healthcare worker has been saying, equip the hospitals. I'm sure in the whole of Nigeria, maybe the number of ventilators may not be up to 100. It's sad. And then I'm talking about ventilators. That's going too far. What about the CT scan machines? How many are in tertiary hospitals? Teaching hospitals. What about the basic chest X-ray? In my unit, we lack a mobile X-ray. And when you're managing newborns, you shouldn't be moving them around the hospital. You should have a side lab where there's a mobile X-ray. And then, there's an opportunity for the residents in that unit to learn how X-rays are being taken, how ultrasound scan is being done, as well as performing search on patients who require those radiologic tests. But those things are lacking, not just in this facility, in so many facilities across the nation. And it's sad because you mentioned earlier that a lot of highly placed immigrant Nigerians, in the US have come from a lineage where hard work, academic prowess is encouraged. And I can tell you that those doctors, those professionals left here, is the same thing for us. We are trained, but where are the facilities? Where are the equipment? If they tell you the kind of CT scan machine we are using in Nigeria, I'm sure it's what they use in some hospitals in Nigeria. It's what they use probably in the 90s. They are old. We are not keeping up with the world. Why? Because our emphasis, we lay emphasis on the wrong things. Buying for the government now, for the senators now, buying vehicles worth some millions of naira. Should that be what the interest of the senators? They come from different wards, different local governments areas. Should that be their interest? How many of them have taken the pain to find out what the facilities, the equipment they have in their ward is like? Reach out to their state healthcare coordinators, their state health administrators, and find out the equipment they have. What are they lacking? It's not just coming on social media and putting up images of you bought 3 ventilators, you bought what is the isolation center? What does it look like? Recently, they have been absconded from Osun State Isolation Center because they said the isolation center was not conducive, was not comfortable. You go to a place and they say they want to isolate you. Mosquitoes are biting you. There's no power. Probably there's no water. The bed is an eyesore. And where you stay is, a lot better. You will prefer to go back to your home. So a lot of things are lacking in Nigeria. First of all, the political will. I keep mentioning the political will because if you give us a huge chunk of the budget and it doesn't trickle down, you tell us that the national budget, health for the health sector or for health, such and such amount was budgeted for, and then we don't see it. If I say as a resident doctor, I want to go on training now, I want to train for this, you see a lot of excuses will come up. Why do you want to go for such training? Why do you think you are due for such training? I mean, why can't you be like Saudi? Saudi is encouraging his young doctors. Oman, Iran, encouraging them. Once you have an idea and say, I want to develop this, the government puts in money to encourage you. But of course, like I said, we space priority. We'd rather spend money, politicians would rather spend money on things they think are more important. Now, COVID-19 is in the country, and we have seen that doctors and nurses and laboratory scientists are not God, but they've been trained to learn about pathogenesis of disease and management. So something you've been trained in and you have dedicated most of your life learning about, you are better prepared to tackle it. But if you are going to, like the Hippocratic Oath states, I'm going to lay down my life for my patients, I have to be comfortable. You have to provide me some comfort. You can't pay me for all the time I would have spent, with my kids, my family, but you can encourage me. So apart from political will, lack of equipment, lack of facilities, I mean, a lot. Okay.
Yeah.
Brain drain.
Right. I am listening to you painfully. Just hearing everything you're saying is painful. And I can only just imagine how painful it must be for you as a medical doctor talking about all of these things that you're saying. And now I feel, just hearing you, I feel now that I don't have to wonder about this article, that was published just about a year ago about the brain drain among medical doctors in Nigeria. And I am wondering if the frustrations that you're describing contribute to this brain drain. That what would actually make doctors, especially the young doctors, who want to be able to do more and to use their skills more productively. It just seems to me that you are explaining to me why that may be, why they would want to move to other countries.
Well, sorry about that.
Oh,
we're talking about brain drain.
Yes.
And it's going to get worse. I'm telling you. You see, I have had the opportunity to interact with a few of my young doctors, colleagues, and the first thing you hear is, Chief, I'm not staying here, I'm leaving. And they're all writing foreign exams. When I left medical school, my mother was like, what do you want to, what's your interest? And I'm like, okay, pediatrics. She said, okay, start writing your primaries. Primaries exam is actually the exams we take to get into postgraduate training. So I started taking my primaries. I took my first primaries. It was in anesthesia because that was my interest. But my husband said, anesthesia is very tasking. As a young mother, you'll be asked to come out at night, to intubate, to do a lot of things. So why not do something that is a little less taxing and you also enjoy? So I chose pediatrics. Now, I wrote my primaries while I was still doing my house job. That's the internship year, the first compulsory year of supervised training, while you are preparing for the full license to practice. So I did that. I passed anesthesia, but when my husband said, "I think you should do pediatrics. You do well in pediatrics," I said, "Okay." I wrote pediatrics. At that time, when you get into the exam, you will see a huge number of doctors, young doctors, as much as 800, 1,000. So the capacity of the hall has to be very huge. And sometimes, they have to separate us into different groups to take the exam. Now, at this moment, there's a huge drop in the number of doctors wanting to apply for postgraduate training in Nigeria. A lot of them are writing foreign exams, taking the PLAB exams, the USMLEs, the exams for Dubai, Oman, Iran, Saudi. So a lot of them are leaving. And when you tell them, they see these things, they see the challenges that we're all facing, and they don't want to come into training like this. I want to train as a doctor. You end up struggling to get paid for allowances, for training. You pay for your training here, yeah. You say, "I'm going for training," and then you pay for your training. You have to go for a course. You pay yourself. If you don't pay, nobody's going to pay for you. The only benefit you will get is maybe the time off for the training. So they see these things, and they know that what obtains out there is not the same. Everyone wants a better opportunity to develop a skill while ensuring that, because a lot of us too, like you said, my parents, they are getting old. So very soon, they probably will be dependent on me, and I have to care for them. So you are working, you need to get proper remuneration. You need to get allowances. And these things are not coming. But you hear your colleagues out there say, "They pay me this, they pay me that." And I developed this skill. I'm able to do this, I'm able to do that, which you're apparently lacking in your country. There is nothing that will stop that young doctor who has gotten such an exposure from remaining in Nigeria. It will take a lot of encouragement. Now, reports from the postgraduate institutes is saying that they can't even afford to pay their examiners now because they are depending heavily on the monies they derive from candidates applying for exams. But the number of candidates have dropped drastically. So what they do, they are going to very soon start laying off or stop inviting some people from coming for exams. And it's reflecting on so many other aspects of the country. Like in those days, you can be here, I have a friend in Ira, and someone complains to you. I say, "Okay, I have a friend in Ira, let me just call him and he will see you." But that your friend in Ira has moved to London or has moved to New York. So you can't easily contact the next person because a lot of doctors are not satisfied with the system. They won't leave, they want out. And it's going to continue, except there are drastic measures to encourage the Nigerian doctor.
Right. I will show you something. You see this article, that was the Nigerian, what do they call, Minister for Labor? Is it Minister or Commissioner? The Federal Minister for Labor.
Minister.
Right. He said...
Yes, he mentioned this. I was going to say that.
Right.
But I guess it's a slip of the tongue because he's a doctor. This is Chris Ngige.
Yes. Right. He said Nigeria has too many doctors.
Well, I think if you meet him now, he'll be sorry.
Yeah, he said that even if the brain drain continues at whatever rate, Nigeria will not suffer because Nigeria already has too many doctors. But it seems to me that that may also relate in some respects to what you were saying when you talked about a lack of political will. And I'm wondering if it's just political will. I know that political will is a big part of it, and I have read some of the studies about the brain drain among medical doctors in Nigeria. They did talk about political will, those studies. They also did talk about the financial remuneration that she spoke about. Uh, but I'm also wondering if it has to do with something that you had spoken to me about earlier, not during this show, when you talked about the lack of intelligent leadership in Nigeria. And I think your words when we were speaking were, one would expect that considering the level of education among Nigerians and the degree to which Nigerians are educated, even in Nigeria, that the people ruling the country will be the intellectual elites.
Yes.
And I recall myself growing up in Nigeria, being in the university in Nigeria, and hearing one of my professors say that those who think hardest shall rule the world. It seems like that's not the story of Africa, at least in recent decades, that those who think hardest do not really rule Africa. Therefore, there is no translation of intellect to governance. So that people do not seem, the Nigerian leaders or African leaders generally, do not seem to understand what you know. That if you are going to create and develop and maintain an effective and country that is going to grow even in the current world and the world beyond, you need to start by taking care of the babies, of the young children from the time that they're born. Before they are born, actually.
Well, I was once invited to a training of young doctors to come and speak about neonatal resuscitation. And before I was allowed to speak, of course, the adult physicians, the anesthetists took over and they were talking. I let them be. When it was done, I was given the opportunity to speak. So I climbed the podium, took over the mic and said, well, I think that every human being starts as a child. And every time, or all the time, the neonatologist must be given special priority. Because if the neonatologist is not, don't think the neonatologist is important, for example, the transition of a child from fetal life to extrauterine life, that's outside the uterus, if there is a problem with that transition, you are going to have problems with the development of the child. And who knows, like I mentioned earlier, who that child will turn out to be. And probably it may be that because of our poor resuscitative efforts, that's why we are turning out bad leaders who assume that they know what they are doing. But because they probably suffered some form of asphyxia, they are giving out bad leadership strategies, and they are not representing who the average Nigerian is. That aside, Nigeria has such rich potentials. We have a lot of good people. We have a lot of intellectuals. We have skillful people. I boarded a flight with what's his name now? Governor Fashola, the former governor of Lagos State. And I had the opportunity of asking him, sir, you revamped Lagos. In fact, when he met me initially, he was just like, I said, let me quickly take a picture. He said, no picture. And my question to him would have been, because if I had the opportunity, I didn't get the opportunity to ask him, would have been, you revamped Lagos. You were able to do such great miracle with Lagos. You did so well. But how come you are struggling in the power sector? We gave you 4 years in Lagos State, and you turned Lagos around in 4 years. 4 years as a minister, I'm not seeing results. What's the problem? We have a lot of gifted people, gifted hands, people who have what it takes to rule this country. But it's either they are not given the opportunity or they are boxed into accepting the status quo. There was one time I asked my uncle, Pastor Fred Odeke, I happened to be very close to him. He's like a father to me. And then I think we just spoke 2 days ago. I wanted to know how he was doing, and he also wanted to know how I was coping And I asked him that, where are the Elijahs of our generation? Because we know Elijah as a very bold prophet who spoke to Ahab and said, there will be no rain except I'm not a man of God. And it happened so because God listened to him. I'm going the spiritual aspect because a lot of Nigerians are very churchy, spiritual, good Christian kind of people. And we're not seeing our leaders, our spiritual leaders, act up to it. And his response to me was, even our leaders have failed God. So I'm looking at Nigeria's problem. It's just unique to us because I've been to Ghana and I see what Ghana is doing. You get into Ghana, as soon as you're flying into Ghana, you can see the demarcation between Nigeria and Ghana, especially if you fly at night. Because everywhere is littered in Ghana. But Nigeria, you will see the darkness that has enveloped the country. And you'll be wondering that what is our problem? This is Ghana that's just next door. I know you bring up the issue of size. And Ghana is a small country, population is small. But I don't know, whatever they are doing, if we do it in each state in the country, probably will have good results. So the problem inherent with Nigeria is bad leaders. And I think the bad leadership that we have is a reflection of the people, because the leaders are among the people. You see a Nigerian today, walks up to you, tells you he has a problem, you help him, tomorrow he becomes a problem to you. So apart from just our DNA as Nigerians, like my husband will say, and the fact that we have bad leaders, then spirituality, we tend to attach, it's maybe the way God wants it to be, to our problems. And there can be a solution if someone speaks up or speaks out. I really can't say much about the spiritual aspect because I'm not a pastor, but sometimes I challenge them. You see a child is brought into the hospital and then you're asking, why was this child not seeing a doctor earlier or has not come into the hospital earlier? And they'll tell you, my pastor said. The pastors are misleading the people, with certain kinds of words that they say. So I would still put this question out. Where are the Elijahs of our time? What happened to the early church that took over the responsibility of feeding widows, feeding people, caring for people in the early time? The church needs to answer to this. The leaders also have a role to play. I'm sorry, I have to run along very soon because I have to take lunch.
No,
and get back to work.
This is really good because it's a conversation that we need to continue to have. I have actually been really excited just listening to you because just listening to you tells me that there is a future for Nigeria. But there will be that future that will be great if there are more people thinking like you and being as active like you. Because one of the things that we know, the research shows that the Nigerian healthcare system is lacking in community participation. And also some of these things that you've just talked about, the quick ascription of bad things, of unhealthy things to witchcraft and to things that may really not be, and to spiritual or demonic things. But I'm not going to hold you much longer because I like us to have to continue with this conversation at a different time. Because I would like to explore with you at some point how the healthcare system really addresses rural needs and how integrated it is. What I like to begin to see with Nigeria across the country, not just in Asaba where you are, It's an integrated healthcare system where early intervention is connected with medical care, connected with psychological care. And so that there is this system where a child is carried along, is helped along from childhood through adulthood. We will continue to have those conversations, but just before we go, I'd like to ask you very quickly, in the place, where we come from, where your parents and I come from, a name like Omo is short for something. So what is your full name? Omo will be a twin, but Omo is something else.
Omo means child, but my full name is Omo Adoni, and it means whatever we labor for, whatever we struggle for, whatever we strive for, our daily goals and desire is to ensure that we give our children the best in life.
So you have given a lot of credit to this man and woman that I'm looking at. And I'm sure that you're really surprised how I got the pictures that I have shown you today.
Wow,
so
nice.
These
That's
are
my dad.
Yeah. And that's your mom.
Yes.
Is that your niece?
That's my niece.
Okay.
My sister's daughter.
So please tell your parents that you spent some time in conversation with a man who said that they raised a very beautiful, wonderful, brilliant child whose values are in the right place. A child who makes not just me proud, but will make Nigeria really proud. And tell them that this person said that he still believes in a place called Ora. And so,
okay, I'll tell them. I'll let them know.
So thank you very much for today. We'll schedule another time to talk because we've only just begun to scratch the surface of everything there is. I know that you brought up COVID-19. I still want to explore that with you and how you're dealing with that as a medical doctor. But thank you very much and have a wonderful day.
Have a blessed day too, sir.
God bless you.
Thank you.
Bye-bye.
Bye.
Thank you for watching my interview with Dr. Omo Emeagui of Nigeria. I would say that it was a conversation that I enjoyed because I learned a lot from it. And I hope that you watching have also had a good time doing so. If you have liked it, please watch my other videos, my other interviews. And also, please feel free to subscribe before you leave this channel. Please subscribe to my channel. And on my part, I will continue to provide you with great content, which I hope that you will also continue to enjoy. Thank you.